In this video, we will travel through time and take a look at important information, events, people, and treatments regarding anxiety and depression. Anxiety is defined as a feeling of intense distress and fear that stops you from accomplishing daily tasks. Depression is defined as a feeling hopeless, guilty, having low self-esteem or self-worth, sadness, or suicidal thoughts for up to 2 or more weeks. We'll start from 500 AD to 1500. Melancholia is recognized as a state of deep sadness or gloom. Scientists realized they need to find out more about melancholia, so tracing the factors of the four humors is necessary. Scientists of this time considered the heart and the brain and the relationship between both. They noted 6 possible factors that affect this relationship: air, physical exercise, sleeping patterns, diet, retention and excretion of bodily fluids, and lastly the passion of the soul. Before the 1400s, mental disorders were religiously affiliated and a sign of possession from the demons. Hippocrates, a Greek physician, has a theory attributed to him which was based off the idea of the four humors, which are yellow bile, black bile, phlegm water, and blood air. An imbalance of any of these four humors are influenced by factors such as the season, climate, geographical conditions, age, mental effort, and dietary habits. Hippocrates also believes that melancholia leads to mental illness, and the treatment was an all-natural vegetable diet and exercise. Later, Hippocrates changed his mind and decided that mental illnesses were affiliated with the mind and not the four humors. The treatments for this new conclusion was a change in environment, living conditions, and possible occupational changes. We're going to skip about 200 years into the 18th century. Advertisement and awareness for these illnesses occurred shortly after Philippe Pinel, a French physician, found out how displeasing hospital environments were. In the late 18th century, a neurocentric approach to medication was available which classified mental illnesses, and Pinel transformed asylum practices. We're going to focus on the 19th century. In the 1800s, Pinel became the founder of moral treatment, which was the cornerstone in healthcare in this century. Pinel believed that better results with patients would occur once the hospitals started treating the patients like children and not animals, considering chains and cages were of use. Dorothea Dix became one of the most influential asylum reformers in the 1800s. After Dix had learned about the work that Philippe Pinel had done, she decided to dedicate her life to improving conditions for patients with mental health problems. After fighting for 30 years, lawmakers provided a fund to establish a state asylum. Dix's document that she had provided for the law was one of the first to outline compassionate care. In the 20th century, Ugo Saletti invented electrotherapy, which was the most controversial treatment of the 20th century. This was similar to the idea of drug-induced comas or convulsions, but these ideas were so violent that it caused patients to break their spinal cords. Saletti went ahead and made something better. It contained a brief but powerful shock that came from a 2-pronged piece that was worn on the patient's head. After World War II, electroconvulsive therapy or shock therapy became more safe and controlled because of technological advancement. Critics and past patients believed this was brutal and troublesome. Psychiatric drugs became available in the 1960s, and electroconvulsive therapy's use had declined. In the early 1900s, Sigmund Freud, a clinical neurologist and famous psychologist, had once owned a private neurology practice and treated disorders such as hysteria, neuroticism, and neurasthenia. Many of Freud's theories still exist today and are widely known, such as his focus on the mind and the unconscious, personality in the id, ego, and superego, and Freud's psychosexual stages, just to name a few. Freud's psychoanalysis consisted of something he liked to call drug treatments. The drugs he had used were antipsychotics, antidepressants, antimanics, and anti-anxieties. Over the course of his life, Freud had treated many patients with mental illnesses. Freud explained the behavior of the illnesses to be better understood and invent therapies for these disorders. Some treatments he used included insulin-induced comas, lobotomies, malarial infections, and electroshock therapy, as well as a few others that were unfavored, so they were dropped from the list. A few years later, in the mid to late 1900s, scientists had successes while playing around with powders and pills that could calm neurological imbalances in the brain to relieve the anxiety and depression. Many thought that institutionalizing patients was the best treatment, but in 1950, deinstitutionalizing occurred because of a large number of staff members and poor living conditions for the patients. This decade was also a time in which antipsychotic drugs were being produced to help patients live a more manageable life. According to Dual Diagnosis, a website specifically aimed towards anxiety and depression, stated that deinstitutionalizing led to a drop in patients from 560,000 to 130,000 in a matter of 30 years. Deinstitutionalizing led to a large number of homeless cases and abuse from the workplace. Dual Diagnosis came up with the statistics of approximately 28% of homeless people had a mental illness of some sort, and also medical technology has continued to evolve in this time. Today, there are many treatments that are all very humane compared to the previous times we have talked about. Some are medication, psychotherapy, and a healthy lifestyle. Our first topic discussed will be medication. A fellow named Daniel G. Amen, a physician, psychiatrist, television producer, and author, states his views on medication. He believes that medication is one of the few proper treatments when diagnosed with anxiety or depression, but it should not be prescribed at the time of diagnosis. Alternative suggestions should be provided at the time of onset, such as more frequent exercise routine, an anti-inflammatory diet, and working with a therapist, which should all be tested out with the patient before retreating to medication. Our next topic is psychotherapy. The staff at Mayo Clinic came up with a definition of psychotherapy as a team. They decided to label it as a more in-depth definition of the simple word therapy. Psychotherapy includes talking with psychiatrists, psychologists, or a mental health care provider. Charles M. Boisvert is an associate professor in many departments at Rhode Island College. In his article, he discusses how when we decide to do psychotherapy, we only think about the positive effects. But there are many negative effects, and he is arguing his side on if there should be warnings stated when deciding to receive therapy. There is proof of deterioration, but there is also great inclination relating to psychotherapy. Another group of doctors from Linehan Institute Behavioral Tech believe that a specific category of psychotherapy, called exposure therapy, works wonders on people who do this treatment. Exposure therapy is a practice of repeated exposure to an object or stimulus in which causes their anxiety to decrease. The doctor from Linehan Institute believes that it is the most fastest and most effective treatment, in which they highly recommend. Our last topic is healthy lifestyle. As I stated before, a healthy lifestyle is another treatment, and this is one you can do on your own. The University of Minnesota's Research Center created a webpage to place their expertise of anxiety and depression with suggestions and information not intended to take place of medical treatment. Optimizing your brain health proves that the brain's ability to continuously change to new experiences, which is called neuroplasticity. Making healthy lifestyle changes from breathing, eating, fresh air in nature, sleeping habits, staying hydrated, and having a healthy and stable support system can optimize brain health, decline the disorder, and incline your overall health. In conclusion, we can see over time trends, patterns, and ideas that have either completely fell through or have stuck around. Things such as lobotomy, the four humors, and institutionalizing patients have left the treatment spectrum altogether, but other treatments such as therapy, and maybe not shock therapy, but ideas have sprung off that procedure, but also eating healthier, exercising, optimizing brain health, and the great finding of pills and powders to make medications all have trended throughout society from centuries on end. All in all, the best treatment for those suffering anxiety or depression, whether it's yourself, a loved one, a friend, or stranger, going to see a therapist, changing your daily living patterns to optimize your brain health, and prescription medication is your best bet on improving and seeing inclines within yourself and a decline of your disorder. Thank you.